Hello, my name is Robert Tasker and I'm your Editor-in-Chief of Pediatric Critical Care Medicine. Welcome to August 2023. I have three editor's choices for you. The first is an SCCM ICU Liberation paper by Lin et al., including 632 patients, over 6,000 days of patient care, and sadly 47 deaths. The authors have looked at the ICU Liberation Program with a QI bundle, A to F or 6 components, ties in very closely with the Pandem paper that we published, and there is an accompanying editorial. The second paper that I've highlighted is by Paquette et al. With 80 ICU intensivists and neurologists and neurointensivists, and this is looking at physician experiences with families around the time of diagnosing death or determining death by neurological criteria and parent refusals. And it's around physician decision making and what those teams do. Highly topical because we've just had the Canadian new clinical practice guidelines published, and the AAP, AAN will be published later this year. So a very important topic. And there's an accompanying editorial. My third paper is by Samuels et al. This is a QI implementation science paper looking at an algorithm of differential diagnosis for new fever with accompanying clinical instability, and the authors have looked at pre-post 4,000 patients and close to 3,000 patients, and there's an accompanying editorial, well worth a read. In the PCCM connections paper section, I have 5 papers on ECMO. The first is the neonatal paper from ELSO on centrifugal versus roller pump devices and ECMO support. The next 2 papers are to do with special populations. The first is status asthmaticus. The second is congenital diaphragmatic hernia. And the other 2 papers, one on nutrition and one on electroencephalography. And then when you finished all of that, there's an excellent narrative to read called The Exchange. So enjoy August's reading, and I hope to see you in September. Thank you very much for all of your support for PCCM and for SCCM.